My name is Creswell Eastman. I'm an endocrinologist with qualifications in internal medicine, also in chemical pathology and public health. I'm currently a clinical professor of medicine in the Faculty of Medicine and Health in the University of Sydney, and a consultant Emeritus at Westmead Hospital in Sydney. Iodine is a micronutrient, and it's an essential building block for the thyroid gland to manufacture, synthesize thyroid hormones. Thyroid hormones control metabolism and growth, and they're essential from the time we're a fetus until the time of old age or death. So that regulates the body tissues and how metabolism works in the body. Now, a lack of iodine is usually a consequence of not enough iodine being in the diet, and then the thyroid can't function optimally. So you lack thyroid hormone, and you have consequences in literally every tissue and every organ in your body. The most important time is in the fetus and in the child, because if the mother who gives the child thyroid hormone via the placenta, it's transferred there during the pregnancy. If the mother doesn't transfer enough thyroid hormone, the fetal brain won't develop properly. There will be significant neurological damage and impairment, resulting in intellectual impairment, intellectual disability as a child, and carried into adulthood. And you can't reverse that. Throughout life, if you are iodine deficient, you will end up with a goiter, that's a swelling in the thyroid gland, which is a butterfly-shaped gland, just in the neck, just below the larynx or the voice box. And that swells when you've got iodine deficiency, and ultimately can cause you problems because of pressure or poor function of the thyroid gland, resulting in metabolic abnormalities and ultimately severe impairment. So iodine is so essential that without it, you can suffer serious illness throughout life. To discuss the problem of iodine deficiency and people at risk in Australia, we have to go back a little bit into history. Back before the Second World War, up until around that time, then goiter, swelling of the thyroid gland, was very common in Tasmania and very common in the eastern states of Australia, from the granite belt in Queensland down through the Great Dividing Range into Victoria. This disappeared, and it disappeared because the dairy farmers were using iodophores, that's using iodine as an antibacterial agent to kill any bugs on the teats of the cows and kill any bugs in milking, in the milk cans and storage vats, etc. And that got into the milk, and that in a sense contaminated the milk, but it was an accidental public health triumph in that ensured that we were getting enough iodine, so goiter disappeared. Now, we thought that there wasn't a problem in Australia until the late 1990s, when we discovered that iodine deficiency in children had re-emerged in Australia. And after some investigation, we discovered that this was a consequence of the dairy industry changing its practices, so that the farmers were no longer using iodophores, they were using chlorine-based sanitizers because they were cheaper. And as a result, the amount of iodine we were getting in our diet dropped quite dramatically, causing there to be a problem of iodine deficiency again in Australia. Now, that has been investigated by my own team at Westmead that did a national study that showed that this was the case, that thyroid glands in children were enlarging, that children were largely deficient, and that pregnant women were deficient. That's been corrected by the governments of each state, or each state health minister and the federal minister for health, agreeing that we need to somehow supplement the population, and that has been done by mandating that all salt that goes into bread must be iodized. Now, that has by and large corrected the problem in children and adults, but it has not corrected the problem in pregnant women. And you might ask, why not? Well, during pregnancy, the mother needs a lot more iodine. She needs to get at least 50% more iodine in her diet to ensure that she can make enough thyroid hormone to pass across the placenta to the growing fetus. Now, even though she might be getting enough iodine for her own needs, she's not going to get enough iodine during pregnancy. So our problem in Australia at the moment is that these women, well, most women, are not getting enough iodine. Their babies are at risk, and we already have evidence that that is having a negative effect. In fact, there was a serious problem in that the IQs of women, the IQs of babies born to women who are not getting enough iodine are lower than the IQ of children that you see in children whose mothers aren't getting enough iodine. So in a sense, there's a threat to the national IQ. That's another way of putting it at a population level. But at an individual level, there's also that threat to that child who clearly won't do as well in education and probably in their career than they would have done had their mothers been getting an adequate amount of iodine. So that's where the problem lies in Australia at the moment, and that's what we've got to address.
I'm Beverly Garside, the CEO of the Australian Thyroid Foundation. Did you know that May is Thyroid Awareness Month? Are you aware that an adequate amount of thyroid hormone is essential to protect your pregnancy and your gestational health? Before you plan a family and when your pregnancy is confirmed, please ask your GP to order a thyroid function blood test.
Currently, I think the most important things we should concentrate on are, first of all, education and awareness. I think we need to educate our medical practitioners, our health professionals better about iodine deficiency. I think we need to make women of reproductive age more aware of the problem, because we aren't using iodized salt in homes. We're avoiding iodized salt in the sense that the marketing campaigns have been pushing these coloured salts called Himalayan salts, most of which come from mines in Pakistan, not truly from the Himalayas at all. And they're supposed to have some special properties in terms of taste or other properties that I don't quite understand with cooking. So the problem is we're not using iodized salt. So the first thing is that I think people should be aware that we are at risk of iodine deficiency. And one of the ways to try and overcome that is to ensure that all salt that we buy and use is iodized salt. Now, I don't see iodized salt in restaurants or fast food outlets. Mostly you see these pink salts, which don't contain iodine. So that's the first thing is awareness. The second thing is that I think that women who of reproductive age should be aware that they need more iodine during pregnancy. They must have more iodine because their diets aren't giving them enough. Now, if they avoid bread because they have a gluten sensitivity, or they think they have celiac disease or a gluten problem, they tend not to be eating bread. And it's a major source of iodine in our diet. There are a lot of women that believe they have or think they may have a lactose intolerance, and as a consequence, they avoid milk. They're the ones that are having plant-based milks, and you only have to line up for your morning cappuccino and listen to people ordering their soy-based latte or their almond-based latte or some other plant-based type milk. Now, they're missing out on major sources of iodine in their diet, and they're going to be deficient by the time they come around to having children. So I think it's an educational matter to ensure that women need to know they need to increase their iodine intake And so if they are not eating bread, they're not drinking milk, then they are at greater risk than the average woman in the street. So most of our efforts should be addressed to, one, as I said, and I'll repeat, replacing any salt that you have and use at home. And I'm not advocating that you use more salt, but if you do, salt, whatever salt you use, should be iodized, number one. Number two, that if you avoid bread and milk, then you're going to be iodine deficient. You've got to make certain that somehow you get a supplement. And the final point is that all women, all pregnant women, should be taking a supplement unless there is some indication that some other medical indication where they don't need that or shouldn't take it, and that's pretty rare. So all pregnant women should know they should be taking some form of supplement, which you have to go and get from your local pharmacy. So they're really what the messages are. I think the other message also applies to children. So again, if your children don't eat bread or they don't drink milk, they're going to be iodine deficient, and you've got to ensure that they get some sort of supplement. That's also true of the elderly. If they are avoiding those foods, then you need to ensure that they're getting some form of iodine supplement. So they're the messages that we need to get out to our health professionals and to the public in general, and to women of reproductive age in particular. Well, the way of identification, you can do biochemical tests, but before you do that, the first is to take a proper medical history. All medical care is based upon taking a history. That's the first thing you do. So the history should include details about the diet. Do you eat bread or baked products? Do you drink milk? Do you eat seafood? Because they're the three major sources of iodine in our diet. Now, if you miss out on one or other or the three of those things, those staples, then you're very likely to be iodine deficient. So that's the first thing, is taking a history and finding out whether that patient is taking in enough iodine in their diet. You can always test that by doing a urine iodine, which is done on a spot sample of urine. You can have that tested in a pathology laboratory, and that will confirm to you if they are iodine deficient or not. So it's overlooked because the patients they're not being asked. They're not asking that question and taking an adequate diet to history of their patient. And if you don't ask, you won't know about it. So the most important thing is to ask that question about the diet.